Tommy begins to stabilize and is transferred to a surgical floor. His parents are relieved since this means he is improving, but worry that he will not be monitored as much on the new floor. They are hesitant to open up to the new team. It's also an adjustment for Tommy. He liked his nurses in the ICU and doesn't want to have to get to know new ones. On the new floor, Tommy remains cooperative but appears more withdrawn. When asked about what he remembers from his accident, he says he doesn't want to talk about it. He gets mad at his dad now that he has returned to work during the day. When his father is about to go home for the night, he asks, "Why can't you just stay here? Grandma's taking care of things at home." Tommy's mother is frustrated too. She knows her husband needs to go back to work, but feels alone and doesn't like having to make decisions by herself. She often calls her mother for advice. She is still not sleeping very much and doesn't want to leave Tommy unless his father is there. One evening, Tommy's sister comes for a visit. At first, she's excited by all the TV and video games, but when it comes time to leave, she clings to her mother, asking to stay the night.
Even when medical transitions signal improvement, they can be stressful and trigger new traumatic stress reactions. Children and families may feel overwhelmed, vulnerable, or become anxious when transferred to a new floor or medical team. For some, the adjustment will take longer until they get to know the providers and navigate the new territory. As the acute trauma phase wears off, parents and children may feel exhausted. Even with a good prognosis, families may be required to make long-term adjustments. Parents may also feel the strain of attending to family needs outside the hospital, as well as on the inside. With ongoing stress, it is common at this stage to see an increase in anxiousness and agitation, along with a corresponding decrease in coping abilities. Parents and children might have a shorter fuse, experience more family conflict, or express more frustration with their providers. School-aged children and adolescents may begin to grasp the seriousness of what's happened and may feel silently guilty about causing the trauma or being the cause of their family's strain and stress. In these situations, it's helpful for healthcare providers to anticipate and acknowledge the normal strain that serious illness, injury, or prolonged treatment can have on families. Providers should be prepared to accommodate a variety of reactions by family members. If Tommy doesn't want to talk, or his mother is feeling anxious, respond with empathy and understanding. Do not necessarily push them. Rather than tell them how to cope, ask, "Is there anything I can do to make this easier for you?" In doing so, you have conveyed empathy, demonstrated understanding, and acknowledged their ability to make choices for themselves. Providers can also help families set up daily routines to restore a sense of normalcy. Encourage parents to lean on extended family and friends to maintain the routines of other children at home, as well as to provide respite so they can attend to work issues, finances, or other needs. Remember that many parents and caregivers will not take a break until they get permission and encouragement to do so from a caring provider. Remind them that taking a break will not only help them, it will also help their child.